Hello, welcome back. And today we have another interesting topic. We're going to be talking about lumpy scarring or keloid scarring that can happen, particularly after you've had an ear piercing or if you've had surgery in the past, but it's most commonly after an ear piercing. We see quite a few of those, don't we?
Mm-hmm. Yeah, we do. So obviously you can almost like a gross looking, can't you? What are the options? Why does it happen? And two, how can we rectify that?
Yeah, so why it happens, there's a genetic component to it.
Okay.
So there's a family history. So people with dark skin tend to have a higher risk of developing what we call keloid scars or lumpy scars. It's just genetics.
Okay.
And also anatomically, so in terms of part of your body, you are at higher risk of developing these lumpy scars. So those anatomic, if you are having any form of surgery on your earlobe, on your sternum, and on your deltoid area, so this patch here, you are at higher risk of developing keloid scarring. And that's just an anatomical thing. It's just the way people are. So that's why when people have ear piercing, because it's on the earlobe, even if you've got fair skin, you are at risk of developing keloid scarring, lumpy scarring.
And when you get these keloids, can they just continue to grow, or is it they just stop as they reach a certain point, or can they just keep continuing to grow?
So it's quite unpredictable. For some people, they will have an ear piercing and maybe 2-3 years later, they might have a little bit of trauma, which they haven't realised, and then it suddenly grows. And there will be a few people that will notice the lumpy scarring as soon as they put the ear piercing in, and it starts to grow. And if it gets stimulated with an infection, that can also trigger a growth. And it can carry on growing and growing and growing. And I've seen very, very large keloid scars. And for some people, it can just stabilize at a particular size. So it's really unpredictable. So you can't really tell. But once you've got them and they start to grow, you can't tell who's going to grow massive and who's going to not grow massive.
So what can you do? Can you cut it fully out, or?
No, that's the very dangerous thing to do, to cut it fully out straight away.
Right.
So first of all, if you're noticing a keloid scar developing in the early stages, particularly if you've recently had surgery or you've just had a small injury there, simple measures such as massage, and you have to be quite firm with your massage, can help soften it. You can have keloid scar tape. So scar tape can be, you put it on your ear or wherever you notice the lump, and that needs to stay on for as long as possible, 24/7. And that can help prevent lumpy scars from getting worse. And massaging with silicone gel also helps. So these are the things that you can do at home to help prevent early keloid scars from getting worse. And you need to take action in the first 6 months for it to be effective. You can't do this 4 or 5 years after you've developed a keloid scar. If you're noticing it happen, early massage, scar tape, silicone gel as well, all those things can help prevent it from getting worse. Now, if you've had it for,
I was going to say, what do you then do if somebody comes here to have something done? What do you do? Do you cut the whole thing out, or?
No, so I would ask to make sure that they've gone through that process. My initial step, they can be very, very difficult to treat. And because it's so difficult to treat, there are so many treatments out there because people are trying different things. But there are a few things that we know have effectiveness, but you have to be aware of the fact that it's never 100% foolproof. So in the initial instance, I would personally start with steroid injections. And that steroid can help soften the scar and shrink the scar or the lump. And you have to be quite religious about having the injection. So after you've had one injection, 6 weeks later, you need to have another injection. And carry on doing it until you notice it shrivel up and soften. And for the smaller keloid scars, that may be enough.
Okay.
And then depending on what happens after that, keep an eye on things, and that might be the treatment for it. Now, for some patients, that might not be enough. What
Right.
it will do, it will soften it and it will shrivel it, and it will shrink it, but not to the level that we want it to. And those patients, we need to be thinking about having it removed after a course of steroid therapy. And it can be effective, but we have to be very careful about how we treat it afterwards. So when we remove the keloid scar, we don't remove the keloid in its entirety flush to the base. We always have to leave a little bit of a nubbin, and that's so the body thinks it's still there and it prevents a regrowth at the base.
Okay.
So when you remove a keloid scar, we remove most of it, but we always leave a little bit of a nubbin, and use stitches that need to be taken out a couple of weeks after the surgery. So we try stitches that are removable, so there's no foreign entity in there to help further stimulate it, and that will cut it out, but there is still a risk of regrowth.
Okay.
And if you notice regrowth at that stage, then we will go back to steroids. So we've created a fresh scar, we go back to steroid, aggressive massage to help prevent it from growing back.
Would you then, if you know somebody who's had that, would you recommend they have piercing anymore, or would you?
That's a really good question. If you are at risk of developing keloid scars, I'd be very cautious, and also let your surgeon know that you've got a history of keloid scars, so they know what to do if you need to have surgery.
Because I'm assuming if you've had more put on your actual face, could you get keloids on your face as well?
Yeah, you can get keloid on your face. It's mainly in the earlobe. For some people, the keloid scar just stimulates from an infection, so they might have multiple ear piercing and maybe only one of them has had a keloid. So for them, we know that the stimulant is probably an infection or a trauma. But if every single ear piercing is keloid, we know that there is a genetic component to it, if that makes sense.
Yes, it does, yeah.
So they are very, very difficult to treat, but you need to have a consistent plan, and you need to stick to that plan and stick to your surgeon or your doctor. And don't give up halfway through, because if you give up halfway through, you lose a lot of the work that you've done. So stay consistent, stay with your surgeon or doctor that's dealing with it, and wait till the end. And it might be, can't treat it, and this is you. And for the serious cases, it's just about symptom management.
And just don't have any more piercing.
Just don't have any more piercings.
The risk is not needed.
Yeah, and unnecessary surgery.
Hey, that's really helpful to know.
Yeah. Great. Well, thank you very much for watching us, and then hopefully we'll see you in our next video.
Yeah,
Bye.